Huntington's disease is a rare brain nerve disorder that can affect people of any age, but will most commonly affect middle-aged people 30 to 40 years old.
Huntington's disease impairs one's ability to voluntarily move their arms, legs, head, and ability to speak normally.
It also decreases one's thinking and reasoning skills, their memory, and their concentration.
It can also cause mood swings and a higher chance for depression and anxiety.
Huntington's is an autosomal dominant genetic disorder, so children of a parent that has the disease has a 50% chance of inheriting the disease.
Many patients with the disease choose not to have children. However, there is prenatal testing available to make sure a fertilized egg implant does not have the abnormal gene.
Despite the very harmful effects of Huntington's disease, there are very few people diagnosed with it.
HD is most prevalent in developed countries in North America and Western Europe, as well as Australia, Russia, Venezuela, Egypt, India, and South Africa. In these nations, more than 5 per 100,000 people have this deadly disease.
The cause of Huntington's disease is an insertion mutation on the HTT gene in the 4th chromosome called the HTT mutation.
The HTT mutation causes a CAG Trinucleotide Repeat, in which cytosine, adenine, and guanine, 3 out of the 4 building blocks for DNA, repeat more than 36 times. This causes the extension of the Huntington's protein.
Then the protein is toxically broken down into smaller pieces that attach to neurons, which henceforth affects brain function.
Huntington's can affect many aspects of people's mental abilities. It prohibits their brain from functioning normally. It can also induce depression. The most visible effect is the uncontrollable movement of body parts. Most people who are diagnosed with Huntington's disease unfortunately die 10 to 30 years after being diagnosed.
Once the disease develops, the person can no longer do everyday activities such as walking, eating, or talking.
If you have a parent with HD, you should get tested, as you may be at risk. Everyone carries a copy of the Huntington gene, but an abnormal copy inherited from an affected parent can cause the disease. Only someone with the abnormal gene can pass it on to children. Some people choose not to be tested because they do not want to be afraid of it developing later in life. Others get tested so they can make informed decisions in the future. A positive test for someone without symptoms currently may remain unaffected for many years. A genetic test can tell patients whether or not they will later have the disease.
There is no treatment that can change the course of this disease, but some medical remedies can lessen the symptoms.
Inheriting the disease cannot be prevented. However, doctors are still trying to find cures for this disease.
The gene that causes HD was discovered by researchers in 1993. Today, there is still no cure and no medical treatment outside of clinical trials because the mutated gene is in every body cell of an adult. Most patients are often placed in a long-term care facility if they have the disease. For those affected, it is important to plan ahead.
According to the Huntington Society of America, about 1 in every 10,000 Americans will have the disease, totaling about 30,000 people. It is estimated that at least 150,000 Americans have a 50% risk of developing HD later in life.
These lives will be cut short without your help.
We're at the organization for hunting down the cure for Huntington's disease.
Hunting down the cure needs funding to further research of the HDD gene. Biotechnology today has a lot of potential, and one day genetic engineering may be able to remove the abnormal gene from fertilized eggs, effectively slowing the spread of the disease.
Please make a daily donation to huntingdownthecure.org to save valuable lives, and we will send you a picture of the person you have given hope to. Help us hunt down this terrible disease today.